So acupuncture itself. The word originates from Latin. It literally means to insert the needle. Acuus is needle, and punctura, to puncture or needle stick. Definitely there are people that have needle phobias, and I totally understand it. It's not normal to think that you would stick your body with a piece of metal and think that you're going to feel better. But I hope at least this picture gives you an idea of the size of the needles that we use. So again, a matchstick, something that you'd be stuck with for an injection, sewing needle, and even these, oh, I'm sorry. There we go, that probably makes a lot more sense, doesn't it? My apologies. Here we go. Okay. When working with releasing tension or reducing pain, whether that's muscular, fascial, scar tissue, for example, personally, I like to vary the needle size. So a lot of it's going to be a palpation, which what I mean by that is more of a feeling sense of what's going on with the tissue. I'm going to vary the needle diameter based off of what I'm feeling through the tissue. If you know a little bit about metallurgy, flex, a rigid needle is going to go through something. That's why we use bigger needles like the medical syringes here. You need it to get to the source of whatever you're injecting, whether it's muscular, whether it's vascular. But an acupuncture needle is a little bit different. You get a lot more feedback through the needle, so you can feel what's going on through the layers. It will drop through where you don't have a muscular problem, and it will stop where things are tight. And that's where the interesting thing is with the flex of the needle. The smaller the needle, the more flex there's going to be. And that feedback then goes through the needle and allows me to know what's kind of going on with that tissue, and you can work with it. Today's acupuncture needles are single-use and disposable, which is awesome. Back in the 70s, 80s, and even through the 90s, they were reusable. They were sterilized, but they were sterilized through an autoclave. And again, if you know a little bit about metallurgy, when you heat and cold something, heat and chill things, they work hardened and they break. So there was issues with needles breaking off in people, which is not a thing anymore, which is a really good deal. And if you want to go further back, you might be wondering, well, we didn't have metallurgy, or metallurgy came way later in life. What did people use? They used bone needles, and that would have been an interesting experience, to say the least. Yeah. So when we start getting into meridians and acupoints, acupuncture treatments influence the body by inserting very small needles, again, into specific points along the body called acupoints. The points that are chosen aren't random. They're selected, again, based around the TCM diagnosis, which you kind of saw a little bit of how we determined, what the pattern was with the common cold. Protocols usually contain local, adjacent, distal points that correlate to your specific yin or yang meridians. So even though maybe you have pain, say, on your leg, there might be needles that are up in your arm. It seems weird, but it's all about the pattern and the connection to what's going on in your body. From a Western point of view, you might be familiar with the fascial planes. There's a really close correlation to them between the 12 meridians. I do have them separate, maybe at the end of the presentation. If you wanted to see them, I'll be able to show them to you. So this is an example of a typical traditional Chinese medicine treatment. The acupoints are placed, again, in correlation to their according meridian. And in this case, we probably got a patient that has a pathology with their wrist, whether pain or lack of range of motion. Something's going on there. That's why the needles are placed in that area. When you consider an average treatment of how many needles you're going to get, they vary. Your average is probably, from a traditional Chinese medicine perspective, 16. And usually it's ideal to do both sides of the body, so front and back if you can. so the potential of 32, but generally at one given time you will have 16 needles within you. Somebody that's a little bit more deficient or weaker constitution, you're going to have less needles, so a younger person can typically take a little bit more. Intramuscular stimulation you might be familiar with, more of a common practice with either chiro or physio. Typically done, or you might have also heard it called dry needling. So usually done with the larger diameter needles. Needles are placed again anatomically specific in regions of the body we know to have trigger points. Trigger points are basically points that we needle that will cause the muscle tissue to contract and then release. This can be an extremely effective process, especially for muscle tension or pain related to muscle tension, but it is definitely a lot more aggressive. And like I just mentioned with the needles that they utilize are usually a lot bigger. The objective is more to stimulate that contraction, which can sometimes have patients go into deep sweat, sense of nausea, lots of pain. Not everybody has these experiences, but sometimes it can be pretty negative, and it's commonly associated with acupuncture, which is unfortunate because acupuncture is way more subtle. The objective is to eliminate the pain and definitely eliminate any negative experiences. Yeah.
When you do something like dry needling, I've had it done.
Yeah.
So when I felt the muscle
Yeah.
contract and then release,
Yeah.
and that's great. But how long does it really last? Because
Yeah, well, that's totally. What's the environment that you're living in or doing? If you're a factory worker that's twisting things all day, then I can release some of the muscle tissue in your arm, but then, you know, an hour later you go back to doing the same thing. That's the environment that you created. So there's other tools that you can utilize to, you know, stretching techniques, and I mean, ultimately it could be changing your environment. That's more of an extreme example, right?
Mm-hmm.
But it's, I guess it's more of the awareness of what's going on with that, and then the tools that you can utilize. Does that kind of make sense?
I think so, yeah.
Yeah, okay.
The that depends answer.
Yeah, it's kind of dancing around
It's
a little
always
bit.
that
Yeah,
depends. Yeah.
totally.
Yeah.
So Japanese acupuncture is primarily what I focus on, and the variation between the Japanese acupuncture and the traditional is it's a single needle approach. So I'm only using one needle at a time. Palpation is critical, so you're really feeling what's going on with the body. You're going into the tissue, you're releasing the tissue, and then you're following it. You can think of it in a sense like if you're holding four corners of a sheet, and then you release one corner of the sheet, that fabric moves. So the loads have kind of transitioned through that fabric. The same thing's going on in your body. The more complicated thing with that is it's not two-dimensional, it's three-dimensional. So there's a lot of stuff that you gotta sort of feel out and work with and be aware of, I mean, anatomically, and then also, you know, allowing your hands to sort of feel what's happening there too. Again, small needles is more common with the Japanese style of acupuncture. What you feel through the tissue is a variety of different things. You can feel very slack, you can feel very sticky, you can feel hard. Again, I kind of mentioned earlier, you can feel through the layers, which is interesting. When you go through like a massage or like deep tissue stuff, you're sort of pushing through. You can almost think of, in a sense, like the princess and the pea, if you think of that story. So you can feel the pea and you can push through it, but you're pushing through all those mattresses. Where the difference then with acupuncture is we're going through those mattresses, we're getting to the pea. Yeah, if you kind of think of it that way. Electrostim acupuncture is probably something that you guys would be interested in. E-Stim is, again, points placed usually more in line with the local pathology. So in this case, you can see somebody who's having an issue with some low back pain. The points stay stationary. I then hook them up to a device that passes a very low frequency. And then low to high frequency still only being 100 hertz. 2 hertz is typically used to release endorphins within the peripheral nervous system. 100 hertz is typically used for issues within the central nervous system. When we're talking about atrophy, we're usually using about 18 to 20 hertz. Completely different feeling that you're going to have in the body with all different types of frequencies. The 2 hertz, you're going to feel more of a tapping. 18, 20 hertz, you're going to feel whole muscle just contract and move, which is weird because you can't control it. You don't tell it to stop. You can't tell it to stop. But basically what it's doing is, if you were to work out in your natural environment, it's causing the tissue to fire, stimulating neurogenesis, which is why it's a great option for something like atrophy. Electroacupuncture really was introduced in the 1960s, actually used for anesthesiology for open heart surgery, believe it or not, with no anesthetic in China, just with needles and points that are being stimulated. So very interesting. Haven't seen that over here yet. There's definitely a lot of benefits in the analgesiac, the pain suppressing abilities of it, and that's more commonly where we'll see it here. But actually, I just ran into a study the other day on a meta-analysis from the Journal of Intensive Care, and they were pro getting electroacupuncture in for cardiac anesthesiology. So slowly integrating into our Western system,
Erik,
which is
can
exciting.
we back up just a little bit?
Yep.
You talked about the neurogenesis, which is regeneration of the muscle or the nerve?
Well, both in a sense, because the nerves are connecting to the muscle tissue, and then the nerves are able to stimulate the muscle tissue, so then
Okay.
you've got the growth. That's sort of that connection there. It's what's firing it so that it triggers it. Otherwise, I mean, that's part of why the atrophy is happening, is there's nothing firing the tissue, so I don't have a purpose, so it fades away.
Okay, so for a lot of people that are new here, atrophy is basically when your muscles stop working or can't feel, do the work anymore. So by doing this stimulation to the muscles, it's giving messages to those nerves that are kind of dying. I'm just trying to think this through, right?
Yep.
And so by giving that stimulation to the nerves, that's what nerves need to stay healthy, is the good nutrition, the oxygen, and the stimulation.
Oh yeah, absolutely. This is just one component. If you aren't eating right, then you don't have the nutrients that are in your blood supply supplying what you need to repair this stuff. Then cool, you're doing something, but you're not doing enough.
Right.
It's like going to build a house and you don't have all the building materials. Maybe you got the foundation, but
Right. So it does a couple of things though. It's going to increase the blood flow, bringing those nutrients and the oxygen.
Yep.
And it's going to send the signals through
Yep.
so that the nerves are getting some kind of stimulation. And then it's going to start working the muscles so they may actually come back awake, if you like, if they're completely atrophied.
Either come back, and again, this is a slow process.
Yeah.
Or at least slow the regression of them, so that
Okay.
you can maintain functionality for a longer period of time,
Okay.
as opposed to not having it. It doesn't replace working out. I'd love to just hook up needles to myself and not go to the gym. There's no
Wouldn't we all?
replacement for that, So it's still great to be out and exercising. This is just something that can be really targeted to specific muscle groups that maybe you aren't able to activate through your exercises, being in a physiotherapy or chiro or whatever else it is that you're doing.
Okay, thank
So
you.
that help.
Yeah.
This is low enough that it would never affect a pacemaker.
Can't do pacemaker. No, the EMF, the electromagnetic frequency, unfortunately, that is the downside of E-Stim. Yeah.
I was told no doctor.
No. Yeah, and honestly, that's probably the closest experience that I could have to it, because you do feel the muscles contracting and triggering. It's still different though, because the needles are actually in the muscle tissue, and that's why it's more effective. But yeah, unfortunately, if you have a pacemaker,
But you could do just normal acupuncture.
you can still do normal acupuncture. When it comes down to atrophy, your success rate isn't going to be as high as if you had an E-Stim. Again, being able to mimic that frequency with the hand and be consistent with that is difficult. That's why the E-Stim machine, that's anesthesiology. I mean, you probably have 5-6 people there, just don't mess up that rhythm. Yeah, you know what I mean, right? Yeah.
How many sessions are we talking about then? Everybody's cases are different, but you don't go in for one and then come back in 6 months on that.
No. way more frequent, and that's a case by case. You start out with probably probably twice a week, just to see where you're at, and then regress from that. But again, like there's, I'll go into a little bit of that later on, but how long have you had the issue, like your age, to the extent of what's causing this, the severity of it. There's a lot of different factors there. It's pretty much impossible to determine the specifics of, like, again, that's sort of a Western protocol. Everybody falls within this. It doesn't really work that way with us. It's catered to the individual. It's all the other signs that we're seeing with you too. It's not just the one specific. That's when, it started getting into a little bit of the stuff with the common cold was the example, but we're looking at everything, like what's going on with your mood, what's going on with your bowel movements, your urinary tract, like everything. You're an ecosystem. We're working with the entire system here, not the individual thing, right? Does that kind of make sense? Yeah? Okay. Another modality of acupuncture is auricular acupuncture. So needles again are placed within the ear, again based off of your traditional Chinese medicine diagnosis. They could be done individually. They could be done in conjunction with acupuncture. I know there's a few clinics in Europe that only do auricular acupuncture, and again for all kinds of different things. Has nothing to do necessarily with your ear. Could have to do with stress. Could have to do with pain. There's really cool things that happen